Good morning, everybody. Today I'm going to talk about sexually transmitted disease. As we know, sexually transmitted disease are very seriously a problem and lead to very seriously complications. In this objective, we try to know what we mean by sexually transmitted disease and also to identify the most bacterial pathogens responsible for such types of disease. Secondly, we are going to demonstrate the laboratory diagnosis of these types of disease, and also we are try to manage prevention, control, and recommendation treatment for sexually transmitted disease. So what we mean by sexually transmitted disease? Sexually transmitted disease, also referred as sexually transmitted infections, are diseases you get by having sexual contact, vaginal, oral, or anal, with someone who already have an sexually transmitted disease. As a result to social stigma that associated with sexual transmitted disease, some negatively impact can occur, which lead to delay diagnosis and the treatment of sexually transmitted disease. Sexually transmitted disease are caused by more than 30 different viruses, bacteria, and parasites. More than 20 sexually transmitted disease can affect men and women around the world. So, sexually transmitted disease can be caused by viruses, bacteria, and parasites. But in this lecture, we are discuss the bacterial pathogen that is responsible for sexually transmitted disease. We can classifications the bacteria responsible for we can classification the bacteria responsible for sexually transmitted disease into gram-negative roots, which included Neisseria gonorrhea and Haemophilus duci, Chlamydia trachomatis, Mycoplasma, which is in case of Mycoplasma ureaplasma species, and spirochetes, which causes syphilis disease. Spirochetes mainly Treponema pallidum. There are some general signs and symptoms of unsexually transmitted disease. Sexually transmitted disease often asymptomatic or have symptoms that they do not recognize as being related to unsexually transmitted disease, such as itching around the genital area, unusual discharge from the vagina or urethra, sores or blister on the genitalia, or sometimes blisters around the mouth, wart in the genitalia, painful urination, and sometimes pain during coitus. One of the most complications of sexually transmitted disease that individuals who get these types of disease became more susceptible to HIV infections by several ways. From that, sexually transmitted disease can open wound or ulcer, which can facilitate the introduction of HIV viruses into bloodstream. And some types of sexually transmitted disease lead to reduced immunity of the individual, which also facilitate the infections with HIV. The most common bacteria that are responsible for sexually transmitted disease, as we mentioned above, gonorrhea, chlamydia, Haemophilus, and Treponema pallidum. With regard to parasitic sexually transmitted disease, one of the most important parasites responsible for sexually transmitted disease is Trichomonas vaginalis, while viral disease range from several types such as human papilloma viruses, herpes, HIV, and hepatitis. The chlamydia trachomatis, according to the chlamydia trachomatis, there are at least 19 serovar, or what is called immunotype, belong to the chlamydia trachomatis species. There are 19 immunotypes of chlamydia, included A, B, B, A, C2K, and also L1, L3. Types A, B, and C causes conjunctivitis, eye infection called trachoma. Also, as we know, this species, chlamydia species, have a distinctive reproductive cycle composed from two forms. This reproductive cycle or replicative cycle of chlamydia composed from two infectious forms. Firstly, elementary body, which is a small, hardy, infectious form of chlamydia species, while the second form called reticulate body, which is large, fragile, infectious form. The main immunotype responsible for causing genital tract infections, the main immunotype out of this 19 serovar, or out of this 19 immunotype, the immunotype responsible for causing genital tract infections is contain types D2K. It is responsible for causing what is called non-gonococcal urethritis, non-gonococcal urethritis, non-gonococcal urethritis, which characterized by urethral discharge, but this infection can be progressed to involve and to causes epididymitis in male prostatitis or proctitis, while in women can progress to causes cervicitis, and sometimes can causes what is called salpingitis and pelvic inflammatory disease. Pelvic inflammatory disease is, and as a result to this complication, as a result to these infections with chlamydia species, the in female also can this type of infection can lead to infertility or ectopic gestation. Ectopic gestation, which is a type of complication occur as a result to infection with chlamydia species, and sometime in this infection can lead to a rare complication of pelvic inflammatory disease called Fitzhugh-Curtis syndrome, which is involve liver capsule inflammation called this complication called Fitzhugh-Curtis syndrome. And sometime in female, when during delivery, when female infected with chlamydia species can lead to neonatal inclusion conjunctivitis. Infant born to infected mother often develop mucopurulent conjunctivitis after 7 to 2 weeks after delivery, and sometimes chlamydial pneumonitis can occur as a result to chlamydia pneumonitis can occur in infant born to infected mother after 2 to 4 weeks after delivery. In addition to that, patients with genital tract infection caused by chlamydia trachomatis have an incidence of osteoarticular manifestations in arthritis disease called Rita syndrome, which characterized by arthritis, and uveitis. Rita syndrome, it is an autoimmune disease occur as a result to infections with many infectious agents, for example, Salmonella, Shigella, and sometimes chlamydia species. In addition to that, chlamydia trachomatis immunotype L1 to L3 can cause other sexually transmitted disease with lesion in the genitalia and can involve lymph node. This type called lymphogranuloma venereum. So other complications or disease, other disease result with infection of chlamydia trachomatis, mainly immunotype L1 to L3, L1, L2, L3 immunotype can causes lymphogranuloma venereum, which is a sexually transmitted disease with lesion on the genitalia and can involve lymph node. Now, how we can laboratory diagnosis of chlamydia species? The most common method for diagnosis of chlamydia infections is surgical method, including ELISA. In addition to that, molecular method PCR. But tissue culture can be used for determining or isolated elementary body, because this bacteria have ability to form inclusion body or cytoplasmic inclusion body, and this cytoplasmic inclusion body can be detected by using Giemsa stain. And the inclusion body caused by chlamydia trachomatis can be differentiated from inclusion body caused by chlamydia bestacei or chlamydia pneumonia. In that chlamydia trachomatis caused inclusion body containing glycogen, where chlamydia bestacei and chlamydia pneumonia did not contain glycogen. And by using iodine we can detect the glycogen filled inclusion body caused by chlamydia species. The most prevention method for prevent infection with chlamydia trachomatis by early diagnosis and used appropriate treatment such as doxycycline, azithromycin, and WHO recommended a prevention control to prevent trachoma caused by chlamydia trachomatis. This program called SAF program, which contain three element tertiary prevention. Tertiary prevention included surgery to prevent bloodness caused by infection with chlamydia trachomatis, and secondary prevention included appropriate demonstrated of appropriate antibiotic treatment, and primary prevention, which included facial hygiene and environmental changes to improve sanitation. So a SAF program combined from three elements used, or this program recommended by WHO to prevent trachoma. These strategies to prevent trachoma included three element. Tertiary prevention included which is tertiary prevention included surgery for patients who have trichosis, patient who have trichosis or enterobion caused by infection, trichosis or enterobion caused by infection with chlamydia species. Trichosis, it is a common eyelid problem in which eyelash growing inward toward the eye, while enterobium it's a medical condition in which also eyelid, mainly lower lid, fold inward, causes uncomfortable irritation, uncomfortable irritation to the eye. So the tertiary prevention included surgery in patients who have trichosis or enterobium, while secondary prevention, it means or included introduce appropriate treatment and to prevent infection and complication of trachoma, and the primary prevention included facial hygiene and environmental changes to improve sanitation. This is a common three element of SAF program, which included primary, secondary, and tertiary prevention, but in reverse order. The second important bacteria that causes sexually transmitted disease is Neisseria gonorrhea. Neisseria species contain two pathogenic bacteria. Neisseria contain two pathogenic bacteria, and also contain many commensals bacteria. This commensals bacteria inhabitant upper respiratory tract and alimentary tract. But the two pathogenic species included Neisseria meningitidis, which causes meningitis. It is also referred as meningococcus, and Neisseria gonorrhea, which causes gonorrhea, also referred as gonococcus. All Neisseria species associated or found inside the neutrophils, inside polymorph nuclear cells, and Neisseria gonorrhea and Neisseria meningitidis classified as biogenic because it is characterized by productions of exudate discharge or purulent discharge. All Neisseria species typically appear as a kidney bean appearance, non-motile, non-spore forming. Neisseria meningitidis and Neisseria gonorrhea closely related to each other, with 70% DNA homology, with 70% DNA homology. And the laboratory diagnosis of this species of this bacteria, the laboratory diagnosis used to differentiate between Neisseria meningitidis and Neisseria gonorrhea depend on the ability of this bacteria to ferment carbohydrate, including glucose, maltose, lactose, and sucrose, because Neisseria gonorrhea ferment glucose, while Neisseria meningitidis have ability to ferment maltose. In addition to that, a type of specimen can be give an presumptive diagnosis for differentiate between Neisseria meningitidis and Neisseria gonorrhea, because in case of Neisseria meningitidis, the specimen usually a CSF specimen or blood, while in case of Neisseria gonorrhea, urethral discharge or high vaginal swab or cervical secretion can be used as a samples. I mean Neisseria meningitidis and Neisseria gonorrhea oxidase positive. So this is an important characteristic of Neisseria species. In addition to that, Neisseria species is produce lipopolysaccharide, because it is a gram-negative bacteria. So it is produce endotoxin, lipopolysaccharide or endotoxin. But some in addition to that, this bacteria also have short chain Neisseria polymers called lipo-oligosaccharide, LOS. So this bacteria have ability to produce lipo-oligosaccharide in addition to lipopolysaccharide. Now we are, as we mentioned, Neisseria gonorrhea non-motile, and it is exclusively human parasite. That means it is causes disease only to human, and this bacteria readily killed by rhinoceros, and for this reason it is transmitted by sexually contact, by sexual contact. The major virulence factor, that facilitate attachment of this bacteria to gentilial mucosa, and also prevent the bacteria from being washed away by urination or vaginal discharge, and this virulence factor, undergo antigenic variation in are villi, which mediate attachment to mucosal surface, and also it is antiphagocytic properties, and also or composed from pillin proteins, and non-biliated bacteria, Neisseria species became a virulent. In addition to villi, this bacteria contain other virulence factors such as obesity protein, and also LOS, LOS protein, poor protein, poor protein, poor protein, and IgA proteases, IgA proteases, and also reduction modifiable protein, which is an outer membrane protein found in all strains of Neisseria gonorrhea. All this virulence factor make this bacteria overwhelm the immune system, and also make it resistance to urination and vaginal mucosa. And one of the most important characteristic of this bacteria is ability to change antigenic structure. One of the most phenomena found and occur in Neisseria gonorrhea is ability of this bacteria to change antigen from generation to generation during growth of single cells. This process called antigenic variation or phase variation, and one of the most important virulence factor undergo this process is pili, lipooligosaccharide, and obesity proteins. Many genetic mechanisms used in this process, but the most important one is recombinational exchange. This process either occurs by RICA independent phase, and as we know, RICA is an essential proteins play important role in the repair of DNA and also maintenance of DNA during replication process. In RICA independent, the antigenic variation or phase variation only undergo switching on or switching off process, while in RICA dependent, DNA polymerase this function play a significant role in this process, which is called slipid stranded mispairing, or slippage of process. And slippage process mainly occur in obesity protein. Now, what the clinical finding of Neisseria gonorrhea? Gonococci can cause localized infections and disseminated infection. Localized infection usually in the genital area, but can be disseminated to various organs through the blood stream. Through the blood stream. In men, gonorrhea characterized by urethritis combined by dysuria and purulent discharge, and sometimes leading to urethral stricture, and local extension can lead to epididymitis, prostatitis, while in women, localized infection found in endocervix, causing purulent vaginal discharge, and cervicitis, which leading to bleeding. And the most frequent complication in women in case of ascending infection is uterine tube infections, which called salpingitis, and fibrosis. Sometimes this infection leading to obliteration of the uterine tube lead to sterility and ectopic gestations, while disseminated gonococcal infections commonly characterized by arthritis and skin manifestation. Septic arthritis is one of the common disseminated infection characterized with infection of Neisseria gonorrhea. Neisseria gonorrhea. Sometimes when pregnant female infected with Neisseria gonorrhea lead to ophthalmia neonatum, which is a purulent conjunctivitis of the newborn during delivery can get the infection from the infected women. A major problem in case of Neisseria gonorrhea is the detection of asymptomatic carrier, particularly in women, and if women are pregnant, this may lead to ophthalmia neonatum, which is inflammation of conjunctiva in newborn, as you can see in this figure. Now, what is the laboratory diagnosis of Neisseria gonorrhea? The diagnosis of gonorrhea infection depend on gram stain and culture of the urethral or cervical discharge. In male, the finding of gram-negative diplococci, intracellular or extracellular neutrophil in smear of urethral discharge provide a diagnosis of gonococcal infection, while in female, gram stain is only presumptive diagnosis, and you must confirm the diagnosis by positive culture, and the culture required special media such as thyra Martin media, and the bacteria can grow under aerobic conditions and sometimes require CO2 conditioning. Prevention of Neisseria gonorrhea. As we know, there's no vaccine for Neisseria gonorrhea. So the prevention involve the use of safety measures and appropriate and immediate treatment of symptomatic patients and also their contact. The other bacteria have an important role in sexually transmitted disease is Haemophilus ducrei, which is gram-negative Coccobacilli biliomorphic bacteria. The cultivation of all Haemophilus species require nutritional supplementation in media, and this nutritional supplementation called X factor and V factor, which are present in an erythrocyte. Haemophilus ducrei require X factor but not V factor. Haemophilus ducrei is an causative agent of sexually transmitted disease called chancroid, which is painful ulcer. A typical lesion is tender papule on the genitalia. It is lack of indication around the ulcer, which for this reason it is called soft chancre to distinguish from the primary syphilitic chancre, which is typically characterized by indurated and painless lesion in case of syphilis. Haemophilus ducrei contain many virulence factors such as fibrillary-like protein, outer membrane protein, and Haemophilus ducrei cytolethal distending toxin. All these virulence factors facilitate attachment of this bacteria to epithelial cells and resistance to complement-mediated killing. There are some evidence that Haemophilus ducrei have an effect to inhibit innate immune response by secreting anti-phagocytic proteins and also by producing antimicrobial peptides which have an effect in innate immune response. In addition to that, cytolethal distending toxin that produced by Haemophilus ducrei have an effect on T cells because this toxin in resembling to DNAs which lead to the apoptosis of human epithelial cells, lymphocyte, and also fibroblast. Mycoplasma, which is also called cell wall free bacteria. This genus contains some species have an important role in sexually transmitted disease. Mycoplasma belong to the genus of Molecutus. There are more than 2 100 known species in class of Molecutus, which is cell wall defective bacteria, and at least 16 of these species are thought to be human origin. In human, four species are primary have medically important, which is Mycoplasma pneumonia, causes pneumonia and has been associated with joint and other infections. Mycoplasma hominans sometimes causes postpartum fever and has been found with other bacteria in uterine tube infection. Urea plasma urealyticum, which causes non-gonococcal urethritis in men and also associated with lung disease in premature infant, and Mycoplasma genitalium, which also causes non-gonococcal urethritis and sexually transmitted disease. The general characteristic of all Mycoplasma species is the smallest known free-living organisms, and it is absence of cell wall. For this reason, this bacteria unstained by gram stain. And also for this reason, I mean absence of cell wall, these bacteria are biliomorphic, biliomorphic in shape. And in addition to that, this is only bacterial contain cholesterol, and as a result to the absence of cell wall, this bacteria resistance to penicillin. Mycoplasma can be cultivated in tissue or in culture media supplemented with nutritional substance and give shape called fried egg shape. Now the genital mycoplasma. Genital mycoplasma contain Mycoplasma genitalium and two species of urea plasma, which is urea plasma urealyticum and urea plasma parva. Both species, I mean Mycoplasma genitalium and two species of urea plasma considered as a sexually transmitted disease. In case of urea plasma, the two pyovar, urea plasma urealyticum and urea plasma parvum, designated as separated species according to the molecular level. For this reason, this this bacteria, I mean urea plasma, considers together as urea plasma species, while urea plasma urealyticum form very tiny colonies, hence called T strain or T form of mycoplasma. Urea plasma can be distinguished from other species of urea plasma by their ability to produce urease enzyme. In women, Mycoplasma genitalium associated with infection such as cervicitis, endometritis, salpingitis, and infertility. And also in male, Mycoplasma genitalium can cause male urethritis, while Mycoplasma hominis is associated with salpingitis and ovarian abscess. Mycoplasma and ureaplasma species may be transmitted by direct contact through sexual intercourse or by oral to gentle contact, and sometimes can be transmitted from mother to offspring or by nosocomial acquisition through the transplanted tissue. The drug of choice in treatment of infection caused by mycoplasma species is such as infection caused by pneumonia or infection caused by mycoplasma genitalium. The drug of choice in this case is azithromycin or tetracycline. Sometimes fluoroquinolone, such as levofloxacin, is also effective, while penicillin and their derivative are not effective because the organisms has no cell wall. This figure shows fried egg colonies of Mycoplasma species, whatever the type of Mycoplasma, when cultivated in artificial media containing nutritional supplementation rich with lipid and cholesterol. This bacteria can grow and give an appearance called fried egg colony. Remember, with regard to sexually transmitted disease, sometimes love is more than a pain in the heart, and you can make a difference by preventing, identify, and treated sexually transmitted disease. Thank you and good luck.